coming to have a conversation with us about the newly awarded Yorkshire and Humber Healthcare Professionals Internship for Cohort 1 for a 2025 start. Yep, we haven't lost anyone, so that's good. So shall we start? So that's us. So because this is part of our Yorkshire and Humber Applied Research Collaborative Lunch and Learn series, we will be recording the session. So I hope that's okay with everyone. That recording will be uploaded onto the ARC website, so you can access that. So if you wish to share it with colleagues who haven't been able to join us, please do. We'll also take your names so we can keep them on a list so we can forward you further information as that's helpful. If we're going to take questions and answers at the end, but if you've got some questions that come to you while we're talking, if you can just pop them in the chat, that'll be really helpful to Carol and I. So without further ado, let me make sure I can move this along. So Carol Burnett will give us a wave on the call, and myself are the co-directors for this award, and we're really pleased to be having a conversation with you to share what we've been able to secure funding for across our Yorkshire and Humber region. And Carol and I are doing this on behalf of our partner NIHR organisations. So Carol's from the Leeds BRC, I'm from the Yorkshire and Humber ARC, and we're in capacity building roles within those infrastructures. So a really exciting collaborative approach across Yorkshire and the Humber. So as I said, this is the first award of this kind that we've secured for Yorkshire and the Humber. It was the first round available to us through the NIHR. It was a collaborative bid from partners across Yorkshire and the Humber, and Leeds Teaching Hospitals are hosting that award for us. But as I said, it is a collaborative effort. So this is the first one open to us. It's now open, and it closes on the 31st of October. Again, apologies from Carol and I around the short timescales for this cohort 1. But the award wasn't confirmed with us until very recently, so we've had to build the road as we're working on it. So apologies from us, but there will be future rounds as well. So this award is open to healthcare professionals, and we thought it was really helpful to be very explicit about what healthcare professionals are: nurses, midwives, allied health professionals, pharmacists, and healthcare scientists. And it is an award to complement an existing job. So it's not a job opportunity, to be really clear. This is a very distinct award to complement your current clinical practice. The award was based on our insight and the opportunity around reaching underrepresented individuals, communities, characteristics, etc. And healthcare professionals absolutely sit within that domain. And both Carol and I are healthcare professionals on one of these registers, which is brilliant. So we really recognise and value supporting wider healthcare professionals. As we've said, the applications will close this time for cohort 1 on the 31st of October. We've tried to keep the eligibility criteria to a minimum to ensure that we can be as inclusive as possible, so as many people can consider applying for this as possible. So you absolutely will need to be a registered healthcare professional for the groups we've just described. You also must be employed by a Yorkshire and Humber institution. And that's because that protects our Yorkshire and Humber geographical area to maximise the funding available for colleagues throughout. We absolutely need you to gain your manager's support, because the contract that, if you're successful, will be issued with your organisation, and then it'll be your manager who will need to support you to release your time from your busy job plans to undertake the internship activity. You need to demonstrate a genuine commitment to developing your interest and understanding in research or service improvement, but upskilling yourself in those research methodologies. So it's about you and your professional development. And we need to see some very clear objectives about how this internship will benefit you and your practice, and potentially your wider team and the community and the service that you deliver. So each award is up to the value of £10,000 per applicant that we're able to offer as support. The main use of that funding should be to allow you to release yourself from your clinical duties. We've done a rough example there of around potentially 30 days. You might want to flex that. Those 30 days can be as flexible as you wish them to be. They can be in blocks of time. They can be a day, a fortnight. They can be however you feel that is going to be most helpful for you to get that development. A second part of that award, or how you might want to slice that award out, is for you to consider your own personal development opportunities. So you might want to access some training, some events, some academic support. And with that, you've got some funding that you can identified to support those other activities. As I've said, the funding will be paid directly to your employer, so it won't change your contractual arrangements. You will just use that funding to deliver on what you've put in your internship. There is a clause that we are being very insistent around that you absolutely have to attend 3 mandatory training days. So the rest of the award is very, very open, but the 3 days that we are insisting that you join us on are outlined on here, 17th of April, 16th of September in 2026, and then concluding in on the 12th of March 2027. I hope some of you have seen the poster and then have seen the QR code. Divine from the ARC will be sharing that information further, but it explicitly shares the different pathway options around this award, from stepping into research, so people with very little or no experience in research and are really keen to dip their toe in the water. And when Carol and I talk about research, we talk about big R, little r, and this little r is mainly around, particularly if you're interested in service improvement, in audit activity, but you wanted to develop your methodological skills in research. So this is a really nice pathway through. The next step through would be growing into research for those people who've got existing skill set, but they want to develop those further, consolidate those. Another element we were really clear that we didn't want to miss is colleagues who are already doing research delivery. So how do we develop people in those particular teams and departments to expand their skills to then do their own research activity? So not just portfolio studies, but to develop themselves as individuals. And then the final level is for people who are really refining and are leaders in this space into developing into clinical academics and practitioner academics to pursue further careers in research. So it really is as broad as we felt it could be and should be, to be as inclusive as possible for across our region. So as I've said, and apologies for this round, the closing date is on the 31st of October. We will shortlist against the criteria I've just outlined. Being an HCP, being employed in Yorkshire and the Humber, showing us the personal development that you're going to go on and making an impact. Invitations to interview will be on the 27th of November, and we'll confirm whether you've been successful or not by the end of the calendar year, so by the 31st of December. You will then commence on the programme either on the 1st of February, the 1st of March, or the latest, the 1st of April. And then you will have up to 12 months to complete that internship. But again, that is dependent on what your preference is around the time you wish to buy yourselves out and how you wish to use that funding that will be available to you, with the proviso that you absolutely need to attend those 3 mandatory days. And one of them is not until March 2027. So that was what all we want to talk about, and then we thought it would be more helpful now if we could stop sharing. And have I stopped sharing yet? No. Hang on. Stop sharing. There we go. Have I stopped sharing?
Yeah.
Yes. Marvelous. To take any questions that you might have. So I'm just going to open the chat. Have we got any questions in the chat? 2 secs. No. So it's all the information we've posted in. Has anybody got any questions they want to put the hand up and have a conversation with us around? While everyone's thinking, Carol, did I forget anything or not suggest anything further that you want to add to?
No, great presentation as normal. I think what we really want to just emphasizes that this is a new internship scheme, and that's why we have new different pathways into accessing our scheme as well. And the outcome for the internship is to try to increase that conversation about research within healthcare providing settings, to try to change some of that culture, to make it so that research is really inclusive, and to really reach out to some of our underrepresented groups, whether they're professions, whether they're your patient cohorts, whether the geographical area where you're sitting, or actually you don't sit in a healthcare provider, you may be sitting in a charity or a hospice or something similar like that. And so just to make it really, really clear that actually it's not all about potentially doing a PhD in the future. You know, this is about trying to allow people to get those experiences, to get a little taster within that research world, to do some maybe QI audit, to increase your networks, to find out people that work maybe in a similar areas to you that you've never met before, but then also to find this kind of wider group of support as well. So it's not all about doing PhDs, it's about trying to embed research within our clinical and our practitioner day-to-day practices.
Thanks, Carol. That's allowed lots of conversation in the chat now. So how do we apply? The links in the chat take you to our website, and within the website, there's clear the application process is there. We're also asking you to submit a, we've given an example CV. I don't know if, Carol, you want to talk about that because you've taken experience from other bids, haven't you? So all the information is on that website. So please access the link or follow the QR code from the poster. So I'll just hand it to you, Carol, for the CV part, the narrative.
And because we're trying to be as inclusive as possible, we're using what's called a narrative CV, which has some framework in it that kind of gives you some kind of recommendations of what you should include in those different parts of your CV. But it's not all about papers that you've published. It's not all about grants that you've done. It's about skills and experiences that you've learned through your clinical day jobs that will allow you to have translational skills that would allow you to, get benefit out of this opportunity that we're asking you to apply for. So it's if you've never published a paper, you've never got a grant, and you've never been involved with research, don't worry about that. Think about those things that you do within your day-to-day job that have allowed you to grow over the time that you've been in that day-to-day job, and show us how you've maybe interacted with patient groups, how you've done some audit, how you've like done some of those kind of like service development projects, or why you want to do those as well. So don't be put off, please, if you've never published anything and you don't have any grant funding. It's not all about that. It's about you trying to tell us the story of you and why you would be a good person for us to give those internships for, and importantly, what that impact would be. So how is that going to help your patients? How's that going to help your department or your ward where you work in? And also, how is that going to help people around you? How do you start those conversations so that it's not just all about you, it's about that group that we're bringing forwards with us?
Thanks, Carol. So a question, I have a fixed term contract until August 26th. I wouldn't be able to attend the 2 later mandatory training days. Would I still be eligible? Unfortunately, Laura, not, because the contract needs to be covering the 12-month period for you to get the maximum benefit, and you absolutely would need to attend those training days. So there's a conversation, I guess, about whether there's going to be a possibility to extend your fixed contract. And then if that is supported, then absolutely you'd be eligible for the award. The next question is, how many places are there available? So there's 23 every year, and we've got it available to us for the next 3 years. So this is cohort 1 of 3. We will be earlier in our advertising and promotion next cohort, but unfortunately this year we are limited in our timescales. So there's 23 available this year and 23 next year and the year after. Next question. I am a newly registered healthcare scientist, I think that is, but I have been in research for over 10 years. Will this internship be beneficial as someone new to the professional register? So this would be really beneficial to you. The other internship I would signpost you to is Insights, or the other program of activity is Insights. Are they not eligible for that, Carol? You're shaking your head. That's what I'm wondering. No.
Sorry, I'm not used to Zoom. I was just about to leave there. It depends. So so with the Insights project, you have to be within that 5 years of registration.
Oh,
So
yeah, you do. That's the point.
it would be dependent on, so you may have been involved with research either pre-registration in a different life, a different role, or whatever else. But the Insights project, which is another program which we can send people the links to, is an opportunity where you can get a funded master's in research to be to apply for one of those. But it is the remit is for people that have been within 5 years of registration.
And that does fit. This person's new to the professional register, so that would work well. So they might have been doing research in a previous world, then they've joined and undertaken a healthcare scientist program. You're new to the register, so you're absolutely eligible for this internship application. And you're also eligible to the Insights programme that's run from Yorkshire and Humber. So we can share that information with you as well. So that's both brilliant. How does it with the funded hours, if it's someone like me who has done very little research, do you have a mentor to support you? A really brilliant question. So we are giving everyone, as they are successful in the award, a buddy. So you will receive an individual to work with you to support you on your internship who has got experience at whatever level you determine is of interest to you. But you also might want to consider in your application how you might want to mould your application to gain additional support as well. So you might have an academic institution that works with your organisation. You might not. That doesn't matter. What you'll be putting in your application is what are the skill sets you want to gain. And it might be connecting with some academics, connecting with people in the field of interest that you're now going to put in your application. That might be to do with a topic with your clinical area. It might be to do with a methodological approach. It might be anything and everything. So please don't worry, you will get support, but actually this is an opportunity for you to articulate what support you need as well as part of that application. Next question. Also, are there other rounds? Yep, so I think I've answered that for you. There will be 2 further rounds after this one, and we'll be out to confirm the timelines around that. We haven't agreed those yet for next year and the year after, but they will be more open, a bigger lead-in is what I'd say to this year. How specific do we need to be on the application in terms of how we intend to use the funding and structure of the internship? So when you go on the website and you can see the information, we've also talked about Gantt charts. What we need to know is that you've got a plan of what you're going to do with your time and with the resource that you're going to be asking for. So we don't expect you to have done a PhD application. So we don't expect you to have nailed down that on the 1st of December, I will be approaching a PPI group. What we're looking for is that you've given some consideration around maybe in the first quarter, that you'll be accessing knowledge and library services to do a literature search to understand more of your topic, maybe. In quarter 2, that you'll be looking to liaise and engage with either patients or people that you work with to understand what that means to you in your role. Quarter 3, you might determine something else. So we're asking you to not be too specific, but give us a general indication that you've given some clear thought to what you're going to do with your time and the funding available to you, so we can feel confident that you're not just going to go and, I'm not saying sit in a library and read a book every week or every fortnight to understand research methodological approaches or research activity, but that might be part of what you want to do. It might be that you want to immerse yourself in understanding how you do it. You might want to connect with another partner in another organisation that's got a similar role to you, that you think they're doing it really well in another part of Yorkshire and the Humber. I've seen them in an article that I've read. Can I go and spend some time with them to understand how they've instigated something? Your outcome might be that you want to launch a journal club, for example. So we're not looking for huge outcomes. We're looking for things that are relevant to you as individuals. On the last day, we will be asking you to share what you've achieved or what you feel you've developed over the internship. But that can be anything from a photograph to a poster to a conversation with colleagues. So whatever you feel is the most helpful for you in your development journey. Carol, do you want to add to that? Because we've had this question before and you added to that beautifully last time as well.
So we have to feed back to the NIHR about, what we've done and how we've used the money and what people have done. So it's really important that we do understand what you've done within that internship. And I think the thing that I really looking forward to, even though we've only just started, is actually to see what people have done on their internships and to celebrate. And so we don't want you to write a 5,000 word article. We don't want you to give us a huge presentation, but you may want to take this opportunity to think, well, actually, during my internship, I've written up an application for a fellowship, and you want to test that with a wider group. You want to show, the pictures of journal clubs that you've taken because of you set up a journal club, and this is something that's new in your department or in your new in your organization. So, it is about being as flexible as possible as to what that outcome looks like. But just to reiterate, you know, it's not a PhD application. You know, you don't have to like write an article, but you can if you want to. And we're here to help as well, and your buddy will be here as well, help as well. So there'll be lots of support for coming to that final piece of work that we're going to do at the end of this internship.
Oh, thanks, Carol. I think that answers the following question. What happens at the end of the project? Do we feedback? Yeah, yes, you do on that final mandatory day, but we will be discussing with you a variety of approaches in relation to that. So please don't feel as though there's one approach that will fit everybody. It'll be led by what you need and want for your development. Another question in terms of backfill within the workplace, does this need to be agreed in principle before applying? And then I'll come to the second one. Absolutely, it does. So that's one of the mandatory fields in the application form that's available on the website that we need you to complete, and it's around your manager's support. So your manager will need to agree in principle that they're supporting what you put into the content of your application. Yes, Carol, you put your hand up. Do you want to come in?
I'm so excited that I was able to raise my hand on Zoom because I don't use Zoom. So there you go. I'm showing off now. But the other thing, Anna, is that there is another part of this internship scheme that we haven't really discussed. And that's like we're very good at supporting potential applicants and applying for fellowships and internships, but we haven't been really good at very supporting our managers. So the second part of this internship scheme is that we're going to be able to provide some education, support, some networking for your managers as well. So every successful applicant who gets an internship, we will be offering some education, some support, and bringing the managers into a study day as well, so that we can actually start to challenge and understand some of those challenges that people feel that are there that are unable to allow our staff to take up some of these opportunities. So we understand that, you know, we have waiting lists, we have that clinical demand, and obviously we're going to be very mindful of it. But we do need you to have your manager support, but also we want to support your managers as well and help them allow this to happen again for further cohorts as well, and to make it so that you get the best opportunity as possible.
Thanks, Carol. So this, I'm just going to come back to another question in a minute, but this leads to this another question from Emma. If we're successful, are we able to delay the starting? So we've had this question in a previous webinar, and unfortunately, we can't guarantee there's going to be a space the following year. I think is what we concluded on because of the reporting we need to do back to the NIHR. So really consider if your manager's not going to be able to release you, they're not going to sign your application anyway. And if they sign your application and then they can't release you, that's a whole different conversation we'll need to have. And that's the point Carol's making about how do we support managers. Carol and I have both been managers. We appreciate how challenging it is to release colleagues out of clinical practice to do these kinds of activities. But actually, we also appreciate the value they bring back to our patient population and our colleagues. So there's something about you negotiating with your manager about this is of interest to you, but what is it that the service could really benefit from? And hopefully those two worlds will align and it will benefit what your manager wants to see from you, but also what you want to achieve as a personal development. So it's engaging in all those negotiation skills. Now, the next question or backward question is if you're in a specialist role, it's really difficult to backfill you. So there's some different options for you to pursue, and that will be under your personal circumstances. If you're part-time, your manager might, and you might be happy to increase your hours for the period of the internship to allow you a bit more flexibility. There's again something around what activity does your service need and what do you want to lead on? What practice do you want to change? What influence do you want to make to your patients and your colleagues? And actually, would it not be mutually beneficial that you maybe not doing your specialist nurse role, but you're doing this activity because it will impact and give a positive outcome on that specialist objectives, for example. So there's not an easy answer to any of this, but it's more about thinking a bit out of the box. And that's why we've not been restrictive about insisting that you do a certain approach or a certain topic or with a certain academic partner or any of that. It's more about how you feel it can benefit you in your clinical circumstances. Carol, now you found that hand button, you were
And my
away.
hand now there. And that's also why we've not been really prescriptive about how you do your internship. So 30 days over 12 months is a quite a flexible potential opportunity, and hopefully that, having that flexibility and like how you actually undertake those hours, is that discussion you have with your manager, but it's to actually work in with your department as well. So, you probably wouldn't want to do your internship days over the school summer holidays or over Christmas holidays, but there may be a period of time where the department doesn't have as many people off rota or off duty, so that would allow you potentially to have your days in those days. So it's about being flexible. It's about understanding how to be mindful for your colleagues and your department, but actually to that discussion and negotiation with your manager to potentially allow you to have those 30 days over 12 months.
Yeah. Thank you. So hopefully that's answered some of those queries. There's another question, a really good one again, Anna. Is this replacing a previous internship? So I think the NIHR have remodeled some funding available across England, and it could be seen to replace a previous program that was run out of academic institutions. Those programs have ceased being available to be funded, and this funding became available. So I don't know whether the correct answer is yes or no, to be fair. So I'm giving you that context. But this is now available, and all those other individual awards that the NIHR Academy have really exploded around for particularly healthcare professionals and underrepresented individuals are available on the website. So this complements all those different pathways and those individual awards available. So it doesn't replace those bigger schemes, is what I would say as well, just to give you some assurance and confidence. Is there anything else? I don't think there's anything else to add to that. Karen, another question. I'm already in work in a research team, but would love to do some work around reaching underrepresented groups and making connections and communities to increase research understanding. This would tie in directly with some of our research studies. Is this allowed? Absolutely perfect, Karen. Yes, it is. That's particularly the third pathway we have been explicit around for colleagues like yourself, Cameron, who are in research delivery teams, supporting portfolio activities, and actually there's something more you want to do that will allow you to develop yourself and of course your team and the activities you do related back to your portfolio delivery work. So yeah, you would be a very welcome application, and hopefully that helps to confirm. There are no more questions that I can see, and I cannot see any hands up. People are really welcome to put the hand up as well and speak to us if they'd wish. If you have any questions following this, we will, on the website, it has got our email address, so please feel free to email us if there's something that you have thought about following this. We are doing another webinar, I think Thursday maybe. So that it's on the website. We've advertised it. We're doing a few webinars. And yeah, we just look forward to having a conversation with you. I would say if you've got a vibrant, engaging research delivery team or you've never reached out to them, this is a great opportunity to speak to them to see how they might support you. But if you haven't, that's not a reason not to apply either. If you've got a university partner that your organisation works with, again, feel confident to reach out to them and use this as the vehicle to have those conversations. But equally, if you haven't, please don't think that's a barrier to you applying either. Another question has just come in. What's the time frame likely to be for next year's applications in terms of when the applications will open? I think we'll aim for something similar, but we'll advertise it a lot earlier. So we'll advertise it throughout the summer to give people time potentially, so a bit onward, because we know we've had the award now. So we'll be a lot more, give you that additional time to be available. But it'll be the same internship standard, so it'll be the same application and entry criteria as what we've already just set out. So none of that will change. Carol.
Anna and others on the call, if you would like, and you could just send us an email to the YHS internships at nihr.ac.uk email.ac, and then we'll include you to our email distribution list so that you'll be able to be aware of what the further rounds are going to look like, but also we're going to do a lot more of this webinar series next year as well, so that you're able to get as much information as possible. So if you want to be part of our webinar email list, just let us know, and then we'll add you, and then you'll get the information when we know what the information is.
And then we'll use that your emails to forward on other opportunities that as and when we become aware of them, then available for us across Yorkshire and Humber, if that's okay. Any other questions? We're both very excited about the opportunity and hope that we see some great applications. The other thing to say is, of course, at the end of this application, if you're successful, you'll be part of our faculty and you'll hopefully then help the next generation, and you can be part of a conversation for cohort 2 to come and say what you've undertaken and how that's impacting on you professionally and your patients and your team. So yeah, really exciting. But thanks for your time, and hopefully you've managed to have some lunch while you've been listening and joining in the conversation with us.